Hello, we are the DAPP Laboratory. We're located at 123 Texas Street in Houston, Texas. The DAPP Laboratory is located in Houston, Texas. We perform tests in microbiology, chemistry, hematology, and blood banking. We are certified by CLIA, AABB, and CAP. This lab is open 24 hours a day, 7 days a week, 365 days a year to serve our patients. The primary focus of the DAPP laboratory is to provide high-quality testing to providers to aid treatment and medical action. The laboratory provides fast, accurate, and efficient results at appropriate costs through quality laboratory management. The laboratory ensures quality by regularly monitoring and maintaining QA, QC, and accreditation. DAPP Laboratory serves all age groups. DAPP is able to provide services to better help special groups that could include mentally or physically handicapped patients, combative or abusive patients, high-risk patients, patients that don't speak English, and patients that have religious restrictions.
Our mission is to provide quality tests and results in a timely manner and to meet the needs of the providers to help our patients. Using the most current methods in laboratory testing and the best laboratory team to provide consistently high-quality results, our laboratory has provided a positive impact in our community and patients' lives. Vision. DAPP's laboratory has set goals that go above and beyond the regulatory standards, leading to high-quality testing. Our continuous quality improvement and high-quality testing is the key that aids our providers and patients. Our laboratory strives to streamline and standardize operations to meet and exceed regulatory requirements. Testing performed today will provide a healthier tomorrow.
Regulatory and proficiency testing agencies. DAPP Laboratory was certified by CLIA, AABB, and CAP. CLIA regulates laboratory testing and requires clinical laboratory to be certified by the CMS before they can accept human samples for diagnostic testing. AABB regulates the fields of transfusion medicine and biotherapies. CMS is the federal agency primarily responsible for implementing CLIA 88 and governs proficiency testing. All laboratories that perform non-waived testing are required to enroll in and perform PT using one of the 13 CMS-approved PT programs. CAP is one of the CMS-approved PT programs. Laboratories undergo the CAP survey every 2 years to maintain accreditation. Test menu and complexity level. The DAPP laboratory performs tests in microbiology, chemistry, hematology, and blood banking. We have a full test menu available that lists all the tests we can do in this lab. The complexity of clinical laboratory tests was determined based on 7 criteria given in the CLIA regulations. These 7 criteria including number 1, knowledge, number 2, training and experience, number 3, reagents and materials preparations, number 4, characteristics and operational steps, number 5, calibration, quality control, and proficiency testing materials, number 6, test system troubleshooting and equipment maintenance, number 7, interpretation and judgment. All tests performed in the DAPP laboratory fall under the high complexity and non-waived testing categories.
Starting off on our instruments that we use in our lab for testing. For a manual diff, all we use is a microscope in the DAPP labs, and for a sed rate or sedimentation rate test, we use an iSed fully automated ESR machine. For a type-in screen test, we use the Galileo Echo blood bank analyzer. For the thyroid stimulating hormone or TSH test, we use a FineCare FIA meter. For platelet count and white blood cell count, we use the HA3100 Touch Automatic Hematology Analyzer. This machine can be used to count white blood cells, platelets, and hemoglobin, so it has lots of different capabilities that can be used in the DAPP laboratories. For a CMP test, which is a comprehensive metabolic panel, a lipid panel, or a renal panel, We use the Beckman DXC chemistry analyzer, which is a very efficient machine for the DAPP laboratories. It can process lots of samples at once and also processes the samples very quickly. So it allows for our turnaround time to be shorter and for better satisfaction from our patients. For a blood culture test, we use the BACTEC analyzer, and for an influenza A test, we use the BioFire machine. We do have some tests in our test menu that do not require an instrument, but are done manually or with a kit. These tests include a fecal screen, a catalase test, cross-match, Kleihauer-Betke or KB test, and the antibody ID test.
Due to the DAPP laboratory having 8 high and 8 moderate tests, we have ensured that each department has enough staff during each shift to perform each category of tests for the average demand we see. Due to having high and moderate testing, DAPP laboratory ensures that each new employee will be trained using the DAPP laboratory orientation and training manual. This orientation and training will occur in the laboratory. Required training for each position will be repeated yearly to ensure the employees understand DAPP policies and procedures. Competency testing is required for employees to ensure proper standards for testing are being fulfilled. All DAPP employees will be tested for competency yearly using an annual DAPP laboratory competency checklist. Testing is performed by lab employees in the lab. If an employee does not meet the competency standards, corrective action will be taken and it can be found in detail in the DAPP laboratory manual. DAPP laboratory supports all full and part-time employees continuing their education. DAPP laboratory will cover any continued education costs related to the field of work via online sources such as Media Lab or related vendor, or classes taken locally in the Houston area. All employees must complete a minimum of 12 hours of continued education per year to qualify with ASCP or licensing standards. For more information, refer to the DAPP laboratory manual. The safety plan is designed for easy follow for employees and patients if needed. It provides a written and visual aid to follow along and shows how we are compliant with OSHA standards. The lab rules show all the do's and don'ts of the lab, such as no eating or drinking in the lab, universal lab rule posters, such as the image in the top right corner, can be found in the safety plan and throughout the lab facility. In the PPE section, all of the available PPE is listed and shown on a person, such as the woman on the slide, to show what the PPE looks like and how it is worn, and then describes why it is important. The waste disposal section includes of where and how to dispose of the different material found in the lab, such as sharps, hazardous, or general trash. An image in the lower right corner of the slide is an example to show that our disposal bins are labeled, colored, and contains contact information for when supplies are needed. Emergency response is outlined for emergency events such as evacuation, fire, injuries, chemical, biological, physical, and radioactive and electrical hazards. The control measures are shown in maps and descriptions of the location for each eye wash station, first aid kit, emergency showers, and fire extinguishers. The SDS are shown in maps and descriptions of the location of all the safety data sheets in the lab and the different departments. The training is outlined for employees, such as the training each employee needs to work in the different labs and the vendors that offer the trainings. The contact information for all the emergency departments, such as the fire department and chemical exposure, and the contact information for the safety manager are included in the safety plan and in each lab. The safety plan is reviewed every 2 years to ensure the policy is up to date.
DAPP Health Systems uses a custom-built Cerner Millennium that allows for specific modules and functions to improve hospital workflow. It also has specialized laboratory modules to include microbiology, blood bank, and atomic path. Cerner Millennium is built to have an integrated clinical, financial, and operational interface, which provides evidence-based solutions via smart orders and smart checks. The advantages of Cerner Millennium for the lab is EasyPass, which allows lab staff to move from one terminal to the next pending workflow without losing any windows that they were working on previously. Cerner Millennium also provides a flowchart tracking for any patient orders to ensure proper patient tracking and specimen processing. It also has a searchable feature for billable frequencies for tests, and it links a search function to the closest ICD-9 code to ensure proper billing and specimen ordering.
Procedure manual. There are two important procedure manuals available in all clinical laboratories. They are Standard Operating Procedure (SOP) and the Material Safety Data Sheet (MSDS). The SOP is a set of written instructions that describes in detail how to perform a laboratory process or experiment safely and effectively. Having SOP in place is very important because the accuracy of test results must be ensured to maintain the quality of care provided to patients. Laboratory work also involves the use of hazardous chemicals. Having SOP will improve the safety of the workplace. Testing staff are encouraged to provide their feedback about the SOP to the QA and the supervisors to ensure the content of the SOP is practical and covers any situations that could occur during the procedure. Section leads and supervisors review the new updates in SOP with testing staff whenever there is a change in effective to make sure the staff is aware of the changes and their execution is accurate. When we are creating the SOP, we have to make sure that there are 17 sections appear in all procedures. For example, the SOP must have the test name, direction for specimen collection, directions for preparing and storing reagents, solutions, calibrators. Also, it has to have quality control, step-by-step directions for performing the test, etc., all the way to the approval and sign-offs. The MSDS lists the hazardous ingredients of a product, its physical and chemical characteristics, its effect on human health, the chemicals with which it can adversely react, handling precautions, the type of measure that can be used to control exposure, emergency and first aid procedures, and methods to contain a spill. When new regulatory information such as exposure limits or new health effects information becomes available, the MSDS must be updated to reflect it. Employers and employees need the information contained on MSDS to protect themselves from hazardous chemical exposures and to work safely with chemical products. The result will be a reduction in chemical source illness and injuries in the workplace. The use and the distribution of MDS have proven to be an effective and efficient way to ensure that employers and employees can obtain necessary information on the hazards associated with exposure to chemicals in the workplace.